Ecosonoids. Let me start the discussion with a synthesis of ecosonoids. Now, what are ecosonoids first? Ecosonoids, these are biologically active metabolites of arachidonic acids. Again, these are biologically active metabolites of arachidonic acid. Okay, so it is important for us to study how arachidonic acid is being degraded, being metabolized in the body. And I believe you are already familiar with the arachidonic acid pathway that is being represented in this presentation. So recall that the major source of arachidonic acid, which is a polyunsaturated fatty acid, is a phospholipid. A phospholipid, which is an example of a membrane lipid in our body. Okay, so again, the major source of arachidonic acid is a phospholipid. A phospholipid, this is a hydrolyzable lipid. Okay, same as a phosphatidil inositol, an alternative source of arachidonic acid. These are hydrolyzable lipids. And as hydrolyzable lipids, they can be easily hydrolyzed by an enzyme in the name of phospholipase E2, or this is abbreviated as PLA2. Okay, so whenever a phospholipid is being catalyzed by the enzyme phospholipase A2, that will produce arachidonic acid, which is a fatty acid. Okay, the chemical name of arachidonic acid is 5,8,11,14 eicosanoic acid. I repeat, chemical name of arachidonic acid, it's 5,8,11,14 eicosanoic acid. So by the name, it says that it has 4 double bonds located at carbon 5, 8, 11, and 14. Located at carbon 5, 8, 11, and 14. That makes the compound arachidonic acid unsaturated because, again, it has 4 double bond. And when you hear about acosa, that would mean that the compound, this organic compound contains 20 carbon. Okay, so this is a polyunsaturated fatty acid. I'm sorry. Ayan. Okay, so again, the chemical name of arachidonic acid, which is a polyunsaturated fatty acid, is 5,8,11,14 eicosanoic acid. Okay. Now, this fatty acid in the body, this is very prone to degradation. Okay. Specifically, name-metabolize siya enzymatically by the enzymes COX or cyclooxygenase or the LOX or the lipooxygenase. Okay. Now, the product of metabolism of arachidonic acid by both pathways, LOX pathway and COX pathway, will produce the following eicosanoids. We have the hydroperoxide, which is a leukotrienes, and the endoperoxides, prostacyclin or the PGI2, prostaglandins, example, prostaglandin E2, and the thromboxane, or this is abbreviated as TXA2. Again, these metabolites, these biologically active carbon-20 metabolites of arachidonic acids are generally classified as eicosanoids. Alright? And in the body, once these eicosanoids are produced, they exhibit diverse effects in the body. Alright? So, for instance, we have leukotrienes. So, leukotrienes, uh, we have the following specific example. We have the LTB4, leukotriene B4, LTC4, the D4, and E4. Now, leukotriene B4, take note, di ba may arrow dito pababa, as labeled neutrophil chemotaxis. Specifically, LTB4, this is said to be a chemotactic factor. Again, LTB4 is a chemotactic factor, meaning it induces the movement of immune cells. Again, it induces the movement of immune cells, which are usually present, or which usually induces inflammation. Again, LTB4, once produced in the body, in the setting of inflammation, it induces movement of immune cells. We also have the LTC4, LTD4, and even LTE4. Sila naman yung mga nagkokos ng bronchoconstriction. Particularly, these are classified as SRSAs. SRSAs stands for slow reacting substances of anaphylaxis. Okay, so once produced, okay, in the body, LTC4, LTD4, and even LTE4, this causes bronchoconstriction because they are said to be potent bronchoconstrictors. So that is the effect generally of the production of leukotriene C4, D4, and E4. All right. So I think those are the most important things that you have to know about this eicosanoids leukotriene. So take note, we have a chemotactic factor, the LTB4, which usually induces the movement of immune cells, especially in the setting of inflammation. Then LTC4, D4, and even E4. These are the SRSAs, a potent bronchoconstrictors, causing bronchoconstriction, okay, in the bronchial smooth muscles. Okay. Now, among these eicosanoids that are produced biologically upon degradation of arachidonic acid in the body, the mostly pronounced or significant number among them are the production of prostaglandins. Again, mas marami po yung napoproduce na prostaglandins in the body. And there are different prostaglandins in the body. Okay, so for the effects of eicosanoids, I will be more focusing on the effects of prostaglandins, okay, the prostacyclin, and also few on the effects of thromboxane. So again, we will now proceed on the effects of the following eicosanoids in the body, yung prostaglandins, prostacyclins, and thromboxanes. Okay, so in the blood vessels, we have eicosanoids that causes vasodilation. Again, in the body, we have eicosanoids that causes vasodilations. Particularly, these are the prostacyclin. Okay, again, PGI2, that is prostacyclin. Production of this eicosanoid in the blood vessel causes vasodilation. Other Ecosonoids that causes vasodilation are the Prostaglandin E series. Okay? Mga prostaglandin. I'm sorry, that's not E2. It should be series. Okay? So there are different diverse types or subtypes of prostaglandin E that causes vasodilation. So it could be PGE1, PGE2, etc. Okay? So mnemonics natin dito para dali lang ninyo madumduman na kani nga mga eicosanoids causes vasodilation. Dilation, we have DICE. Okay? DICE. DICE for vasodilation, ang nagkukos ng mga eicosanoids. We have prostacyclin and the Prostaglandin E series. Okay? Now, other effect, okay, there are other eicosanoids once produced in the body. Yung kinokos naman nila is vasoconstriction. Okay? Halimbawa, production of thromboxane A2. Okay? In the blood vessels, production or release of thromboxane, including prostaglandin F2 alpha. Again, prostaglandin F2 alpha. These causes vasoconstriction. So please take note of the effects of these eicosanoids on the blood vessels. It could be vasodilation for prostacyclin and PGE series, vasoconstriction for the release of thromboxane and prostaglandin F2 alpha. Now, in the bronchial smooth muscles, the following could be the effects of the production of the or presence of eicosanoids. We have bronchodilation. Okay, bronchodilation. Once prostacyclin and prostaglandin E series are synthesized in the body. So, do not forget lang, basta dilation ng smooth muscles, may it be vascular smooth muscles ng vessels or the extravascular smooth muscles ng bronchioles, that causes with PGI2 and PGE series dilation yung nangyayari. Okay, so don't forget the mnemonics, dilation, prostacyclin, and prostaglandin E series. Bronchoconstriction naman, okay, for the following eicosanoids. So yung kanina, 'di ba? Sabi natin, these leukotrienes causes bronchoconstriction. Okay, so take note, LTC4 or LTD4, okay, particularly the SRSAs, they causes bronchoconstriction, including also prostaglandin F2 alpha. Okay. Now for GIT, gastrointestinal tract, okay, we have the effect cytoprotection. Okay, cytoprotection. I think I have mentioned this sa mga prior discussion during nung na-introduce ko sa inyo yung arachidonic acid pathway, wherein kapag na-produce yung prostaglandins, di ba? Prostaglandins that are very important for cytoprotection. That prostaglandin are actually the PGE series, particularly the prostaglandin E1. Okay, the prostaglandin E1 that is very important for cytoprotection. Next, for the platelets, okay, we have platelet aggregation. Okay, effect. Okay, sa platelet, pwedeng platelet aggregation. Okay, aggregation. Okay, particularly the presence of or release of thromboxane A2, okay, from the platelets that causes or from the blood, okay, blood endothelium, blood wall endothelium that causes platelet aggregation. Okay, and there are also prostaglandins that causes inhibition naman. Okay, inhibition of platelet aggregation. Okay, this includes the following prostaglandins. Dumdumi lang yung dyes ulit. Okay, yung dyes ulit. Okay, so we have prostacyclin, the PGI2, and the PGE1 series. Okay, bakit dyes ulit? Kasi somehow, kapag sinabi mong platelet aggregation, 'di ba? Platelet aggregation, that induces clotting. Okay? Yung pamumuo ng dugo. Okay, pamumuo ng dugo. What is the opposite kapag walang clotting? Okay, 'di ba? Improve yung flow ng blood. So somehow, pwede nating i-relate yung dilation. Okay, dilation. Kasi pag may clotting, there is somehow narrowing of the blood blood vessel. Okay, because of the clot that is formed. So, kung inhibition naman, kapag inhibited yung platelet aggregation, walang clotting, dilated somehow yung blood vessel. Okay, so that is the effect also of prostacyclin and PGE series, particularly the prostaglandin 1. And then for the uterus naman, it particularly causes contraction. Okay, ecosonoids, we have ecosonoids that causes contraction of the uterus smooth muscle, the uterine smooth muscle. And there are also prostaglandins that induces contraction of uterine smooth muscle that will later on lead to dysmenorrhea. Okay? So, one factor kasi nagkakaroon ng dysmenorrhea yung women, it's because of the action of prostaglandins. Okay? So, we have prostaglandins that causes contraction of the uterine smooth muscles. So, these are the following. We have the PGE series. Okay, it could be PGE1, 2, etc. And also the prostaglandin F2 alpha. So please take note, these prostaglandins, okay, they causes uterine smooth muscle contraction. And finally, we have prostaglandins that causes reduction. Okay, baba yung IOP, okay, intraocular pressure. So example, we have the prostaglandin F2 alpha ulit. Okay, again, this is much more effective, very effective. Okay, we have analogs, no, analog synthetic analogs ng prostaglandin F2 alpha, very effective, very efficient for the reduction, okay, or decrease of IOP. Then other includes the prostaglandin E series. Okay, so these are the effects in general. So, gisummarize ko na siya para mas madali siya. Okay, so we have effects of eicosanoids sa blood vessels, could be dilation, constriction, bronchodilation, bronchoconstriction for the bronchial smooth muscles, for the GIT, cytoprotection for PGE1, platelets, it could be platelet aggregation for thromboxane, and inhibition of platelet aggregation, we have the prostacyclin and the PGE1, uterine smooth muscle contraction, or oxytocic yung effect, diba? Oxytocic yung effect with PGE series and prostaglandin F2 alpha, and reduction of IOP for PGE series, and the most effective is the PGF2 alpha. Okay. Now this time, let us discuss those analogs, synthetic analogs of prostaglandins. Okay, so I will be discussing the synthetic drugs, okay, available in the market. Okay, yung mga analog ng prostaglandin. So I'll start with prostacyclin. Okay, so epoprostenol, take note, this is an analog of prostacyclin. So prostacyclin again is PGI2. Again, this is an analog, analog of prostacyclin. Okay, hindi yung natural na prostacyclin, synthetic one. So analog, ginaya niya lang yung chemical structure ng PGI2. Okay, so epoprostenol, this is very useful for the management of primary pulmonary hypertension. Recall that prostacyclin, di ba, in the arteries, in the blood vessels, example, the pulmonary arteries, they can cause vasodilation. Okay, so pwede sila for the management of pulmonary hypertension. Okay, because again, they are used as a vasodilator. They can somehow dilate the pulmonary artery. Okay, then we also have the mesoprostol. Okay, mesoprostol. This is an analog naman of prostaglandin E. Okay, prostaglandin E1. Okay, prostaglandin E1. This is actually marketed under the brand name Cytotec. If you are familiar, yung Cytotec. This is the brand name for mesoprostol. Okay, para saan? Mesoprostol, this is actually used as cytoprotectant. Okay, this is used as cytoprotectant. Okay? Kaya pwede siya for the management of peptic ulcer disease. Okay? Particularly those NSAID-induced peptic ulcer disease. Okay? So, I think you already knew, no? You already knew why group of drugs classified as non-steroidal anti-inflammatory agents may induce peptic ulcer disease. If you recall here in the pathway, di ba, we have prostaglandins that are very important for cytoprotection. Example, yung PGE1, no? Yung PGE1 again very important for cytoprotection. Now, drugs like NSAIDs, again, they inhibit, okay? They inhibit COX. Okay? Remember, they inhibit COX. Therefore, kapag na-inhibit yung COX, pigil yung pathway under COX. Mapipigilan yung production ng prostaglandin. Example, the prostaglandin E1, which is very important for cytoprotection. Therefore, pwedeng mag-induce ng peptic ulcer disease yung NSAID. Okay? Kaya, di ba, kung naaalala nyo, the best recommended counseling kapag yung patient is taking NSAID is always tell the consumers or the patient to take the NSAIDs after meals. Okay? They must be taken after meals para somehow protected yung lining ng stomach. Knowing na kapag kumain ka, di ba, kapag kumain ka, somehow napapababa niya yung HCl. Kasi yung gagawin ng HCl, it will digest the food into the, that was being entered in the stomach. At saka mo na yun, inumin yung NSAID. Okay? So, yung mesoprostol, yung Cytotec, for cytoprotection talaga siya. Okay? For cytoprotection. Okay? Kaya, aside sa cytoprotection effect niya, alternative to. Okay? Pwede siyang alternative use for the management of NSAID-induced PUD. Kasi again, yung pinaka-first line pa rin for peptic ulcer disease, di ba, is the PPIs. Okay, so alternative yung mesoprostol. Okay. Now, an adverse effect, a very common, no? Common adverse effect ng misoprostol is, excuse me, is it's abortive patient effect. Okay, aborti, I'm not sure with the spelling. No, abortifacient. Okay, kanang nagkukos siya ng abortion ba? Nagkukos ng abortion yung cytotech. Okay? So, familiar naman siguro mo na cytotech nagkukos ng abortion. In fact, instead nga ginagamit yung misoprostol for its clinical application nga cytoprotectant for protection sa stomach lining, mas ginagamit yung misoprostol because of its adverse effect na nagkukos siya ng abortion. Okay, but that is not legal here in the Philippines. Kaya as dili kayo ni siya gina-prescribe basta-basta lang. Okay, so women, especially mga pregnant women, yung cytotech. Kasi again, nagkukos siya ng abortion. Bakit siya nagkukos ng abortion? Recall that PGE1, PGE series, nagkukos sila ng uterine contraction, okay, uterine smooth muscle contraction or oxytocic nga effect. Kaya meron siyang abortifacient nga adverse effect. Next, we have Alprostadil. Alprostadil, this is also an analog of PGE1. Okay, isa din siyang analog of PGE1. Particularly, ginagamit siya for the management of erectile dysfunction. But of course, this is not the first line, no, in the management of erectile dysfunction. Second line lang po. Second line. Okay, second line, treatment lang ang Alprostadil for erectile dysfunction. Kasi yung first line pa rin are those orally taken na mga drugs. Okay? Orally taken na mga particularly orally taken na mga phosphodiesterases nga inhibitors. Example is yung sildenafil. Okay, sildenafil. Isa ito sa mga first line, the management of erectile dysfunction. Isang PDE inhibitor. Yun yung kailangan as first line. Orally taken nga inhibitors of the enzyme phosphodiesterases. Okay. Now, another use of alprostadil is to maintain patency of Ductus arteriosus. I repeat, yung Ductus arteriosus, this is a normal part of the baby's circulatory system in the womb, okay, ng mother, okay, during pregnancy. Particularly if I will illustrate it, okay, if this is the Ductus arteriosus, it actually connects the pulmonary artery. This is the pulmonary artery of the heart. Okay, yung Ductus arteriosus, that connects, no, that is an opening that connects pulmonary artery with the aorta. Okay, so it simply connects the two major blood vessels from the heart. Okay, yung Ductus arteriosus. Okay, sa fetal, sa baby, that is very much open. Okay, open yung vessel na yan, yung Ductus arteriosus. Okay, to allow connection, communication between a pulmonary artery and aorta. Normal yan sa baby's circulatory system. Now, ano ba yung importance ng Ductus arteriosus? This is very important to keep the blood ng baby away from the lungs nila. Kasi yung lungs ng baby is filled with amniotic fluid pa. Now, para mas maintindihan, let me illustrate, no, the normal physiology of the heart. Let's say, for instance, this is the heart. Example lang ha. Yan yung heart natin. Okay. If this is the heart, so ato siyang hation into 4 quadrant. Kaya di ba na ay 4 quadrant ang heart na siya. Right atrium, Sa baba, di ba, right ventricle. Then, dito sa kaliwa is the left atrium. Then, we have the left ventricle. Okay? So, nga na, usual nga, physiology, representation, diagram, kung i-illustrate nato ang usa ka heart. Okay? Let's say, sa taas, naadi-ari ang superior vena cava. Okay, superior vena cava. Then let's say dito sa baba, nadiri ang inferior vena cava. Okay? So kung naay blood nga pabalik, okay, may blood na pabalik sa heart, syempre it will fill in sa right atrium. Okay? It will fill in the right atrium. Now, from the right atrium, it will go down to the right ventricle. Then from the right ventricle, di siya mo diretso sa left ventricle, of course. Sa right ventricle, it will pump, no? It will pump the blood through the pulmonary artery towards the lungs. Okay? Again, yung blood, okay, yung blood na bumalik sa puso, it will initially be pumped, no, by the right ventricle into the lungs via this large vessel, the pulmonary. So ito yung pulmonary artery. It will carry a blood, okay, a deoxygenated blood, okay, towards the lungs. Okay? So, ang purpose gyud deoxygenated. Okay? Yung purpose talaga ng pulmonary artery, normally sa ato ang heart, normally, ang pulmonary artery, nagdadala siya ng dugo, deoxygenated, oxygen poor, no, nga blood into the lungs para ma-oxygenate. Okay? Sa lungs, mag-pick up siya og oxygen. Okay? Yung dugo, mag-pick up siya ng oxygen. Then, babalik yung ulit, yung dugo, yung oxygenated na ngayon na dugo via pulmonary veins, no? Veins, pabalik, no? Veins, balik ng heart. So, this time, oxygenated na yung blood na babalik sa heart. It will be filled sa left atrium, okay, then goes to the left ventricle. Then from the left ventricle, it will be later on finally pumped, okay, pumped out from the heart, and it will be yung oxygenated blood na this time, it will be pumped out, it will be distributed into the different tissues ng body via the aorta. Okay? So papunta ito sa systemic circulation, yung blood na yun, kasi oxygenated na yun. So, muna siya normally ang circulation ng dugo. Okay? Mula sa peripheral tissues or central tissues, padulong sa heart, then i-oxygenate yung blood sa lungs, then babalik yung oxygenated blood ulit sa puso, then that will be pumped out, be circulated into the different tissues ng body. Now, sa bata, okay, sa bata, which is not really bata, fetus, no, sa fetal, sa baby's circulatory system, yung ductus arteriosus, okay, yung ductus arteriosus that connects the pulmonary artery and the aorta. That is very important nga open dapat na siya. Okay? Open dapat na siya because that will keep away, okay, the blood, okay, from the lungs ng baby. Okay? Kasi yung lungs ng baby, that is still filled with fluids, amniotic fluids ng womb, okay, of a mother. Again, this opening, the ductus arteriosus, which is an essential component of fetal circulation, this is very important to send out, no, the oxygen poor blood, okay, ng fetus body. Okay, so again, it will allow the pulmonary artery, it will send away the oxygen poor blood to leave the fetus through the umbilical artery. So Sa fetus, dili siya moadto sa lungs ang oxygen poor blood to be oxygenated kasi nga not well functioning pa yung lungs ng mga fetus. Lalo na kung napa sa loob ng womb ng mother. Okay, so yung purpose ngayon ng pulmonary artery, okay, this time, it will send away the oxygen poor blood, okay, towards, okay, it will leave, no, the fetus, the blood, oxygen, poor blood, it will leave the fetus, okay, through the umbilical artery, okay, artery. Okay? And later on, ano yung magiging source? Paano magiging oxygenated yung blood na papasok ng heart ng fetus that will be pumped out to the circulation ng baby? Yung oxygen, it will get back to the placenta. Okay, so it will be the placenta that will pick up the oxygen, okay, for letting the blood of the fetus to be oxygenated again. Okay? So, babalik yun sa left atrium. Then, yun yung oxygenated blood na ngayon that will be pumped out, will be distributed to the different tissues ng fetus. Okay, so yan yung importance ng ductus arteriosus during fetus kapag nasa loob pa ng womb yung baby. Now, you have to take note na yung ductus arteriosus, this opening, okay, that closes shortly after birth. Okay, kapag lumabas na yung bata, shortly after birth, it will later on, hinay-hinay na mag-close ang ductus arteriosus. So, there will come a time nga after birth, magko-close yung ductus arteriosus. Okay, so that's normal. Okay, that's the system normal. Now, kapag nag-remain, no, if ga-remain og open ang ductus arteriosus, if it remains open, if persistent yung opening, that is what we call PDA. Okay? That is what we call patent ductus arteriosus. I repeat, this opening, yung ductus arteriosus, if this remains open even after birth, that is called patent, no? Patent ductus arteriosus. And PDA, the patent ductus arteriosus condition, is actually a congenital heart disease. Okay, this is a congenital heart disease already. Okay, nga kahit after birth, later on, after days, weeks, open pa rin yung ductus arteriosus. That is considered a disease already because delikado yan for the babies, for the fetus, because remember, a pulmonary artery carries oxygen poor blood. Okay, oxygen poor nga blood. So if the ductus arteriosus remains open, there could be a possibility na magkaroon ng mixture ng oxygen poor blood, okay, sa blood that is carried by the aorta. Remember, the blood that is carried by the aorta that is being pumped out by the heart towards the different parts ng body is already an oxygen-rich one. So kapag nag-leak yung oxygen-poor blood into the aorta, pwedeng oxygen-poor blood yung ma-distribute through the circulation, and that could cause harmful effects to the human. Okay? So let's go back to the drug Alprostadil. Okay, so Alprostadil, it says here that it maintains the patency, or it maintains the opening. It keeps the ductus arteriosus opened. Now, in some cases, there are certain condition na kailangan i-maintain yung patency, yung opening ng ductus arteriosus. Say, for example, during cyanotic lesion, okay? Or any surgery that involves the heart of a newborn, usually, kailangan i-maintain yung opening ng ductus ductus arteriosus. Other condition of a baby na kailangang i-maintain yung opening ng ductus arteriosus is during interrupted aortic arc. Okay? Sa newborn. So again, if there are certain surgeries that has to be conducted, that has to be done to the heart of the baby na kailangang i-open talaga yung ductus arteriosus, then alprostadil is usually used to maintain the patency of ductus arteriosus. Next, dinoprostone. So, yung dinoprostone, this is an analog. Okay, this is an analog of PGE2. Okay, an analog of PGE2. Recall again that PGE series, they causes uterine smooth muscle contraction. So very good siya for cervical ripening. Again, this is important for cervical ripening. It enable the dilation of the cervix during onset of delivery. Okay, again, it is used for cervical ripening during delivery. So it enables, okay, to dilate the cervix during onset of delivery. Then in the US, this is actually an FDA approved abortifacient. Okay, it causes abortion, and this is given via vaginal administration. Okay, yung available kasi niya, dosage form na available niya is in the form of suppository that is administered vaginally. Okay, so isa siyang vaginal suppository. Yung available na dosage form niya. Okay, if it is used as abortifacient. Next, latanoprost. Ito naman, this is an analog of prostaglandin F2 alpha. Okay, prostaglandin F2 alpha. This is marketed under the brand name Salatan. Okay, this is available under the brand name Salatan. Ang management, ginagamit siya for the management of glaucoma. Okay, bakit siya pwede for glaucoma? Ano ba yung ginagawa ng PGF2 alpha? Recall, it reduces IOP, intraocular pressure. And lastly, carboprostromethamine. Ito naman, another analog din to ng prostaglandin F2 alpha. Ginagamit siya as abortifacient naman. Okay, recall, PGF2 alpha, meron din siyang activity towards uterine contraction, uterine smooth muscle contraction. So, pwede din siya as abortifacient.